Gun violence is now the leading cause of death for children and youth in the USA. While the devastating impact of incidents can have an emotional and psychological impact that extends well beyond direct survivors. To discuss the impact of gun violence amongst youth and how we can help, I'm joined by DOJ's Will Bronson and Dean Kilpatrick at the National Mass Violence Center. Thank you, gentlemen, for being here and working and doing all you do to try to eliminate or at least reduce what has been an incredibly difficult problem in our country. So I think we first need to talk about the broad impact of violence. Dean, I'll start with you.
Well, I think it has a very broad impact, not only on victims and survivors, but also on whole communities. There was a study done a few years ago, but I suspect if they repeated it, would find the same thing, that about half of adults said that they were afraid that they or a family member would be attacked in a mass violence incident. Also people tend to buy guns for self-protection in addition to perpetration, and so we're very heavily armed, partly because of the fear of mass violence and other kinds of violence.
There are different ways to look at this, of course, mass violence and then community violence, but one thing we have to talk about clearly is healing, and it's not a linear process. So can you talk about how challenging the healing process is?
It can be extremely challenging. We know that victims of crime have a myriad of issues that they are regularly dealing with, from the emotional, oftentimes physical challenges. We know that people are oftentimes exposed to new systems and new processes as they are engaged with trying to find healing or trying to find justice as a result of their victimization. At the same time, people are still trying to deal with life. They're handling work responsibilities, family responsibilities at a time where they can be having increased levels of anxiety, fear, and helplessness as a result of their crime victimization. So we know it is oftentimes one of the most challenging times in a crime victim and survivor's life. So it is extremely important that we be cognizant of that and be mindful, so we can put services around folks to best wrap around, to best promote their healing. One of the things that I am pleased to be able to say is that the Office for Victims of Crime has victim services organizations that we support in all 50 states and all the territories. So there are services available to victims.
So how do you get that message to community members that I really am here to try to help you heal?
So engagement is the term that we like to use. OVC oftentimes are engaging folks in the community, of the communities that they're from. That's a very important piece. Going back to the challenges of crime victim survivors, we know that services, when we're dealing with folks, have to be culturally specific, and oftentimes language barriers can propose a challenge. So when we're putting in services in place, we are oftentimes all the time engaging with communities to ensure that our services are being most responsive to their needs, again in a culturally responsive manner that is really looking to promote healing as best we can, again, for those communities, in those communities.
Dean, can you speak to that a little further, this idea of needing to tailor some of these services?
Well, I think you definitely do, because particularly, and I'm a mental health professional, so I approach it from that aspect. But people don't have really good expectations about getting help from mental health services. They also, a lot of times, are suspicious. They have a lot of stereotypes about what the recovery process is like, and so one of the things is that people expect to be kind of upset for maybe a few days or a few weeks. They don't really understand that for many people it lasts for many years. Service systems too are in the same situation, in that they are really designed to provide help right away, but then they're on to the next mass violence incident.
I'd like you both to answer this next question, cognizant of your own areas of expertise here, and that is how important it is and what you can learn from survivors.
Well, I think they're the experts on what happened. We're not. And if we do not engage them and find out what it was like for them and what they need, then we're not going to be very successful. So although a lot of people wouldn't think of this as being making victims the experts, one of the things we do in our epidemiological research, that's just a way of systematically talking to a lot of victims and finding out what they need and what they want from us. So I think it's just critical to involve victims because we may think we know what they need, but they don't necessarily agree.
How does it help being here at APHA, having everyone in a room being able to communicate these issues and their commitment to them?
I just think it's wonderful. For us at OVC, it's an opportunity for us to engage with a variety of stakeholders and for us to push forward our message. For me personally, it's an opportunity to let folks know that there are services available and the government at this local, state, and federal levels are here to help.
And I would just say that it's invigorating because if we're going to address violence, both the causes and the consequences of it, we really need to do that as a team, and public health is really a very important part of that. But being a mental health professional who has gotten involved in public health stuff, I think my perspective is helpful perhaps to the public health field, but I think the public health field and the criminal justice field's perspective is very helpful to me. And so when we get, there's a synergy of getting different perspectives on things, bringing different tools to the same problem, and then using the tools that we have from our perspective to help out working with others collaboratively to address a really gnarly problem for our nation.
Well, gentlemen, thank you so much for being here, and thank you for all you do.
Thank you.
Thank you.